One of the key distinguishing features of Better Beginnings, Better Futures is the involvement of community residents as partners in every aspect of the initiative, including the research, with some residents hired to work with the site research teams.
And those people were employed by us, but they lived and worked in the communities and did the research. And for the first several years, they spent a tremendous amount of time collecting information on the processes that really contributed to the development of the programs themselves and the management structure.
You know, I lived in the community for 8 or 9 years and was very, very excited to be part of this groundbreaking 25-year-old Canadian-only longitudinal study, so it was very exciting for me.
The Better Beginnings, Better Futures team conducted 3 types of research. Outcome research, primarily quantitative; program development research, primarily qualitative; and economic analysis. Parents, residents, teachers, and service providers were involved primarily through research committees established in each of the communities.
We made it, kind of front and center of everything that we did, so that it wasn't research is over on the side. It was integrated into what we were doing.
I liked how the research team involved teachers right from the beginning in terms of giving feedback on the programs, but also having a chance to look at the questionnaires and maybe suggest more appropriate ways of asking questions.
The research committees were part of the management structure in each of the communities, and they were set up to review all of the research plans and to contribute to their development. So the research development process was quite interesting, actually, in Better Beginnings, because it wasn't laid on by the government. It wasn't laid on by us, the research unit. It wasn't determined solely by the communities. It actually resulted from sort of the ongoing negotiations and discussions of all 3 of those groups.
Information for the Better Beginnings research was collected through several sources. The data were collected when the children were in junior kindergarten, senior kindergarten, grades 1, 2, 3, 6, 9, and 12 for children in the 3 Better Beginnings sites, as well as 2 demographically matched comparison sites.
The researchers recruited just about 1,000 children from the 3 Better Beginnings communities, and then they found 2 communities that were sort of like Sudbury in Cornwall and Etobicoke, and those were the comparison communities. So they recruited 1,000 children, and these children were all 4 and 5 years old, about 14 or 15 years ago.
Examples of evidence that Better Beginnings has been effective can be seen in multiple areas, including child outcomes, outcomes for parents and families, and neighborhood and community outcomes. Child outcomes include improvements in children's social skills, improvement in self-control, improved parent ratings of children's overall health status, reduced hyperactivity, and lower rates of use of special education services.
If I didn't come to the program, I think I'd either be at home, sitting down, doing nothing. I think here is a lot more fun and you can do a lot more things. I've made quite a bit of friends.
Parent and family outcomes include a reduction in maternal smoking, improved parental social support, and improved family functioning at particular follow-up time periods, specifically grades 6 and 9. Neighborhood and community outcomes significantly higher levels of parental involvement in neighborhood activities, a greater sense of community involvement, and a pattern of greater neighborhood satisfaction than parents from comparison sites at the grade 6 follow-up. Economic analyses showed that, based on the average of $2,991 spent per family for participation in Better Beginnings, Better Futures programs, the government has saved approximately $4,569 per family by grade 12 on other services including education and social services. Therefore, for every $1 spent by the government, there was a savings of approximately $2.50.
The positive outcomes in favor of the Better Beginnings children and family actually strengthened over time, so that by grade 6 and particularly grade 9, the children academically were doing better than the children in the comparison communities. Their families were functioning better. The children showed less use of special education. They did better in school. Their teachers saw them as being less hyperactive, as showing fewer emotional problems. And these positive outcomes were stronger at grade 9 than they had been earlier. By grade 12, we still saw positive outcomes in favor of Better Beginnings kids. We saw that their parents were less involved in the social welfare system.
We believe that, in implementing this research, lessons have been learned that can help others evaluate their own initiatives. These lessons include that it's important for research and evaluations to be built in right from the beginning, and that the researchers take the time to carefully choose the research design, research approaches, and instruments in consultation with the local communities. It is important to involve residents, teachers, and service providers in the research process to enhance the research and to increase local ownership. Qualitative research is a valuable addition to research on community-based prevention programs and should be mixed with more traditional quantitative outcome research. The research needs to be well funded. It is important to conduct an economic evaluation of prevention programs for children, and it is not enough to do the research and report it in scientific journals. The knowledge gained from research needs to be transferred to government to inform public policy.
Translating research to policy is always a tough call, and many researchers are reluctant. Many university-based researchers are reluctant to engage in that kind of research because it's oftentimes very difficult to publish or to publish quickly. We've been at this. I mean, we had our biggest publication of our research published in 2010. We started this research in 1991, but it's allowed me to maintain this sort of dual track of academically honest, solid research informing public policy.